Very good morning to everyone. I wish the roads in Mumbai looked like what the hall looks like right now. Our study is a very simple yet unique study, and I will be covering this under these headings. We attempted to look at the time spent by a surgeon at each step of phacoemulsification. So each step meaning the time spent in the paracentesis, the time spent right from the beginning of the rhexis to the end of the rhexis, and that is what we have done and analyzed the differences between the expert and the trainee surgeons at our center within a defined study period. So experts were consultants who had experience of more than 500 surgeries, where the beginners were fellows and residents with experience of less than 50 surgeries for independently performed surgeries. All consecutive surgeries were taken for analysis. So this was unique because there has been no such study where one person looks at each and every step in phacoemulsification. There has been software which looks at particular steps, but this was unique in that aspect. We were happy to see that the visual acuity outcomes of beginners were also good, but definitely the visual acuity outcomes in experts were better. The total time, the time spent in each step was much lesser in the experts as compared to the beginners, which is no surprise. But what is surprising is when I show you these box plots. Now, if you look at this box plot, you can differentiate between the two by looking at this horizontal line, how far apart they are, the amount of overlap between the shaded squares and the whiskers that you see here. So quite clearly the rhexis time was lesser in experts. So was the total phacoemulsification time, the total time that was spent in irrigation aspiration. But what is very surprising, or not really surprising but never reported, is the time that the trainees spent not doing anything, looking at the eye, was the biggest difference between the two groups. Also was the difference that it was spent in exchanging time, exchanging instruments. This means that the entire training which we spend on doing these steps properly may not help in reducing surgical time. What is required is paying attention to the microscope handling, but through wet lab and simulators, clarity on the surgical steps, what is to be done next, and visualization on any expected, unexpected turns and asking for the next instrument. And of course, because other steps also are a big difference, continued improvement on the actual surgical steps. So a slight change in focus on training and you can reduce the surgical time quite drastically. Thank you.
Yeah, that was really a very nice presentation, but I just want to ask you, which step you think is the important for the residents, wherein they spend more time? So out of all the steps you have mentioned.
So the biggest difference lies in the inactive time. Unlike other steps of phacoemulsification, the time that they spend not doing anything, just watching the eye, is the biggest difference.
Okay.
But probably they are watching because the teacher is teaching them.
No, these are all independently performed surgeries. So basically, they probably just inject visco, start looking at the eye again, do a particular step in rhexis, or do half phacoemulsification, pull the probe out and start watching again, figuring out the thing. So that clarity on thinking what should process. They do probably is not there.
Do you think it was a structured learning? Is it a structured learning at LVPI, meaning first you learn this, after 50 things, 50 surgeries, you learn the next step? So then in that case, before starting the actual phacoemulsification, the time required by even these trainees would be less.
So these people have done 50 surgeries under observation, after which they are allowed to do independent surgeries. And though there is bound to be a difference, our aim was not to look at or criticize their lack of skills, but to understand where more teaching is required. And that understanding, I think, we gained from this study.
So how many students and how many teachers were compared?
Oh, sorry, there were 45 surgeries. The sample size calculation was 42, based on the previous studies, based on software analysis.
So 42 students?
42 different students, 42 different
consultants.
Based on your observations, what difference would you like to make in the training?
So we have already started doing this. So for our residents, we start showing them videos and ask them for an instant answer for what should you be doing next. So that is something that's very simple. So at a point when we sit with them and look at their videos and we see they're doing nothing, so we try to understand what is it that they have stopped for, and we have realized that it is just they feel a greater need to see the eye. That is understandable, but they've started improving once we have more discussions on these things.
More familiarity.
More familiarity.
Well, everyone has done smoothly. Surgery was uncomplicated at the hands of...
We did not take into consideration the surgeries which were complicated.
Okay. But extension of a study, if suppose a complication occurs, in that particular case, in which step that student or consultant has taken more time? Have you done that sort of analysis?
Yeah, that is something that will be very nice to do, but...
Kochi 2023.
Yeah, means then you can analyze that if you go wrong at that stage or you have taken more time maybe.
Comparison, possibly yes, the relative lack of complications in the expert group may be a factor which may come into...
And we presume that the grades of cataract were same and everything else was same.
Everything was same. These were all uncomplicated cataracts, 8 mm dilated NS 2 to 3.
Same machine.
Same machine.
Same machine, everything. All other parameters same, only thing these two subsets.
Exactly.
Very nice concept and good way of learning also.
Thank you, Dr. Dixit.